And it's the money. I keep talking about the money. Just throwing money at something and not getting bang for your buck doesn't seem to me to be the answer to all of this. I worry about waste. I worry about inefficiency. I can't believe we've spent 37 billion on test and trace. I just can't believe where some of this money goes. Well, joining me to discuss this is Kristian Niemietz from the Institute of Economic Affairs, an organisation that looks very hard at money, how government spends money. Let me ask you something. Is it the IEA's view that the National Health Service is this sacrosanct organisation that is, as Nigel Lawson once called it, the nearest thing to a state religion, and we should keep the model more or less as it is?
Well, the IEA has no corporate view, but I think on this one, I think it's safe to say that none of us thinks that, no. I think we are the ones who question the national religion on this one. Because there are better systems out there and somebody has to talk about those as well.
Well, let's talk about those, because, you know, we're constantly, all through my life, we do health comparisons with France, health comparisons with Germany. Other countries are said to be better at preventative medicine than we are, but they have different economic models, don't they? Different funding models.
They have, absolutely, yes. I mean, I've long been a fan of the private insurance model in the Netherlands, for example. That's a system where the whole population, everyone has private insurance. That doesn't mean that it's a pure market system. They still have a safety net. The government makes sure that everyone can afford private insurance and to make sure that private health insurers cannot discriminate. But you otherwise get a market provision of healthcare. You get private hospitals, you get private health insurers. You can choose, and you are the customer. And that does mean if you are not happy with what you're getting in one place from your healthcare provider, from your healthcare insurer with a particular model of provision, you can go somewhere else.
Not as radical as that. It was interesting in the House of Commons a couple of weeks ago. Sir Edward Lee, very senior backbench Conservative Member of Parliament, got up and said something that I've been saying here since last July, since I've been covering this subject. Namely, why don't we give people tax relief if they're prepared to put money into private healthcare schemes, because that would at least relieve some of the burden off the National Health Service. I mean, that would make sense, wouldn't it?
That would be a first step, yes. And that exists already in some places. That is more or less the system in Australia. They have a state-run health insurer, which covers the entire population. But they also have that system that you described, selective tax relief if you get private insurance. And just over half of the population, I think, make use of that option. And that means, yes, they take some burden off the public system. Now, of course, you also have to have a separate recruitment system in the private sector, because if public and private systems are just competing for the same doctors, then it doesn't help. But if those private healthcare providers have that independence and can have their own contracts, then that can be a way of taking some of the pressure off the public system.
Whenever any debate about any form of privatisation comes up in this country, I mean, people start screaming.
Yeah, been there.
I mean, screaming, as if you're on the verge of committing some terrible, heinous crime. It was interesting, talking to my previous guest, and the point that he made, which perhaps doesn't help in terms of this debate, but the point that he made was that when the National Health Service outsources, whether it's cleaning contracts or hip replacements or whatever it may be, his point was whenever it does that, the bill's even more expensive.
That is true in some cases, especially where you had private construction of hospitals and then leasing it back to the NHS. That kind of system, the so-called private finance initiative. But that is because in that case, it's not the consumer who's in charge. It would be a government entity awarding the contracts. And as someone who believes in consumer choice, in free markets, I believe that the state is a bad entrepreneur, but I also believe that for the same reason the state is bad at contracting. So it's not about just handing out contracts to private organizations, it's about putting the consumer in charge so that the consumer can decide, I don't like what I'm getting here, I'm going there instead. And you don't have that with, I mean, I didn't listen to the previous section, but I'm guessing that would be what he was talking about, those sorts of arrangements. And the test and trace scheme that you mentioned, that would be...
How we spent all this money?
That would be a perfect example.
And what's the benefit been?
That would be exactly that kind of arrangement where you have just a government entity giving out a contract to a private provider. And of course, if you tell a private sector organization, you get lots of money, we're not going to monitor really what you do with it, then yes, someone is going to take advantage of that. But it would be the situation where you can choose, and you are the consumer, that's when you make wise choices.
For you, you think the Dutch system's the best system, don't you?
Yes. I mean, they have roughly the same level of spending that we have, but they get much better outcomes pretty much across the board.
And for a taxpayer, is it insurance? See, we hear medical insurance. We think America. We think, it's good because American medicine costs a fortune, and that's partly because of their legal system, where people sue each other for $30 million or whatever it is. If I was a normal, ordinary taxpayer, and we switched to the Dutch system, how much more would that cost me?
On average, it would be about the same as now. Because, total spending in the Netherlands is almost identical to British levels.
Per capita spending.
Yes.
All right, I tell you what, Kristian, you've got a very, very hard sell here.
I know. I haven't made many friends with this.
It's tough. Last question. Does the NHS spend too much money on bureaucracy and middle managers and structure?
It must do somewhere. I've never quite been able to work out where the money actually goes. But you can see that in terms of overall spending, we are now slightly above average in the OECD, in Europe, spending slightly more than a lot of comparable countries. But we have fewer doctors, fewer hospital beds, fewer nurses. So where does the money go? It must go somewhere. But
well, I know. Kristian Niemietz from the IEA, thank you